If you can deal with the short-term problems like anxiety, exhaustion, it will help prevent those longer term, what you would see a more traditional post-traumatic stress disorder, which is unfortunately what I see coming from this crisis. First responders are exposed to trauma, and unlike veterans, they're exposed to trauma on a daily basis, right? So from our perspective, it's an underserved population. But at the end of the day, if you don't take care of yourself, you're not going to be doing as good of an effective job as you could.
How are these resources being distributed, and what are those resources?
We have master level clinicians, so like licensed social workers, folks that are experts in trauma. And it's like what we're doing right now over video telephone conference. That's secure. That's not, it's HIPAA compliant. And we're able to give treatment for 15 minutes up to 2 hours, whatever they need. Right. So if somebody's on the front lines, they may only have 15 minutes to talk.
What about those who just find it hard to talk about it? I mean, how do you talk about something like that?
It's difficult. We're not getting into the really longer term treatment that you would normally see for post-traumatic stress. We're dealing with the situation in the moment.
What happens if someone perhaps has a specific insurance?
We're going to take on the administrative burden of the insurance. We're waiving any kind of copays. We're waiving any kind of deductibles. We're taking that on ourselves, and we're paying that out of pocket ourselves. And with the insurance, if we can't figure it out with the insurance, nobody's ever getting a bill for it.
There's like a weird stigma around mental health, and you know this.
There is.
We just don't talk about it, or we don't even know how to talk about it. What can people at home start doing?
As this progresses, we are going to have to take on stigma head on. In order to do that. But to answer your question, I think just being there as a family member, just saying, listen, whenever you're ready to talk, if you need to talk, I'm here for you. And we support you and thank you for what you're doing.
Can we see this expanding a little bit?
Unfortunately, a lot of folks are out of work. A lot of the clinical folks are out of work because, like you said, with the social distancing, you can't have group therapy. But with that, this is going to fundamentally change how we deliver mental health treatment. We are planning on hiring a clinical team as we expand.